Olá a todos, eu sou Fernando Korkes, estamos aqui com mais uma edição do SBU in situ. E agora quem está aqui com a gente é o Dr. Craig Jones, que é urologista em treinamento no último ano em Manchester. Ele ganhou agora o prêmio da sessão de posters de câncer de próstata avançado, com um estudo bastante interessante e com potencial de mudar a prática clínica. Então vou pedir para ele explicar um pouquinho sobre esse estudo, sobre o uso de ácido zoledrônico para a gente. Craig, first of all, congratulations for your prize, for your study. And if you could please explain for the Brazilian urologists and oncologists a little bit about your study, this STAMPEDE arm of the study, and what you did and what are the outcomes.
Yeah. So we looked at patients randomized to the STAMPEDE arms A, B, C, and E, which were the ADT with docetaxel, ADT with zoledrônic acid, and combination treatment. And we looked at routinely collected healthcare data. So this was inpatient data for patients admitted to hospitals in England and Wales. And we used a pre-specified coding framework to identify fractures in this population, either diagnosis codes or procedure codes. So the common ones we saw were vertebral fractures, hip fractures, and those requiring surgical intervention. And the baseline characteristics were comparable across the trial arms, and our objective was to really define the fracture incidence in men with metastatic and non-metastatic disease, and also to assess the impact of zoledrônic acid on fracture risk. And what we saw was that men with metastatic disease had a much higher incidence of fracture, so at 5 years it was about nearly 10% in the overall cohort, versus only 2% in those with non-metastatic disease. And when we stratified patients with metastatic disease as to whether or not they received zoledrônic acid, we saw a significant risk reduction with a hazard ratio of 0.36, which is very powerful, with a difference of about 9 to 10% in terms of fracture incidence at 5 years, suggesting that, perhaps contrary to current guidance, where it's not routinely advocated for, I think there's compelling evidence to say that we now should be strongly considering bone protection in all men with metastatic prostate cancer, starting lifelong hormone treatment.
Amazing. So we're talking about potentially practice-changing data. Thank you very much for your time, and again, congratulations.
Thank you very much. Bye.